I come to the floor to share real stories of real hardships from hardworking families in my home state of Iowa. 7 years ago, Americans were promised that the Affordable Care Act would make health insurance cheaper and health care more accessible. Well, I won't pretend to break any new news here. The facts speak very much for themselves. Obamacare is not living up to its promises. When passing the law, the other side made promises that they knew wouldn't be kept. The irony here is that the so-called Affordable Care Act, at the end of the day, is anything but affordable. So let's look at that word affordable from the Webster Dictionary. Quote, having a cost that is not too high, end of quote. I've heard from many Iowans who tell me in no uncertain terms they cannot afford to buy health insurance because Obamacare is unaffordable. Ever since Obamacare was enacted, I have received letters and calls and emails from Iowans who are frustrated about the soaring costs of their health plans. Here's a prime example. One farmer's insurance premium went through the roof. It jumped 43% in 2017 from 2016. If somebody can explain how that's more affordable, I have an oceanfront property in my home county of Butler County of Iowa to sell you. Now, we have a chart here about another Iowan. This constituent from Garner, Iowa, wrote about her financial hardships. She said, these figures, this illustrates it, quote, we are going to be paying over $1,300 a month on premiums plus a $6,000 deductible. We don't have that much longer before we qualify for Medicare, but my concern is that until then, we will have to use so much of our hard-earned savings just to pay for health care. My fear is that those of us in the middle class will struggle with paying so much that it will wipe out our retirement savings accounts, end of quote, from my constituent from Garner, Iowa. Another constituent nearby Garner in Buffalo, Iowa, wrote to me saying, quote, I am forced to pay $230 a month for a health care plan that covers nothing until I reach $11,000 in deductible. So on top of paying 100% of my medical bills anyway, now I also have to pay for insurance I can't use, end of quote. Well, everybody knows how we got to this point. So the question, how did we get to this point? 7 years ago, I stood right here on the Senate floor and predicted what would happen to the cost of insurance if Obamacare passed. Let's take a walk down memory lane for a moment. Here's what I said October 2009, quote, and while some of the supporters of these partisan bills may not want to tell their constituents, we all know that as national spending on health care increases, American families will bear the burden in the form of higher premiums. So let me be very clear. As a result of the current pending health care proposals, most Americans will pay higher premiums for higher insurance, end of quote. Now, I'm not Nostradamus, but I don't have a magic crystal ball, but it was easy to read the writing on the wall. I knew that layers of new taxes and, more importantly, burdensome new mandates in Obamacare would lead us to where we find ourselves today, a broken health care system that is not better off than it was 7 years ago. For millions of Americans, it is much worse. So where do we go from here? After 7 years of rapidly rising premiums, soaring deductibles, and climbing copays, Republicans are committed to fixing the damage caused by the Affordable Care Act. But what do you see? Instead of joining us in our effort to fix what's broken, the other side is doing their best to scare the living daylights out of Americans. From the way they tell it, the House bill is, quote, unquote, deadly. What's truly fatal is the death spiral the Omaha marketplace, or the Obamacare marketplace is in. Not only is it unaffordable for too many people, it is simply unsustainable. Obamacare is unable to fulfill its promises to the American people. Here's what every lawmaker in Congress ought to agree on. Insurance isn't worth having if patients can't afford to use it. And the facts are very clear. One-size-fits-all government-run plan is driving insurers out of the exchanges, driving up premiums, driving away customers, and driving up the tab to the tax-paying public. And I spoke 2 days ago about the impact in Iowa, that probably after June the 19th, 94 of our 99 counties won't have insurance plans in the exchange, so even if you benefit from the subsidy of Obamacare, you aren't going to have an insurance company to go to. And all of this because Obamacare has overregulated, overtaxed, and oversold its promises to the American people. Obamacare has not healed what ails the U.S. healthcare system. It's time to move forward. So I urge my colleagues to drop the partisan charade and join us for the good of the American people. I will continue coming to the floor to share how Obamacare is not working for Iowans. But in the meantime, the Senate will continue working to rescue our healthcare system that's sinking under this broken law.